Welcome to our guide on essential first trimester tips for a healthy pregnancy. The first 12 weeks are crucial for your baby's development, so let's dive into the key care guidelines and precautions you should follow to help you lay the best possible foundation for the journey ahead. The moment you suspect you might be pregnant, often confirmed by a home pregnancy test, marks the beginning of an incredible journey. While that home test provides an initial indication, it's absolutely vital to follow this up with a visit to your doctor or a healthcare provider. One of the very first and arguably most important recommendations your doctor will make is to start taking prenatal vitamins. Among these, folic acid stands out for its critical role in the early stages of fetal development. Ideally, you should begin taking folic acid even before conception, if possible, but starting as soon as you know you're pregnant is key. Folic acid is instrumental in preventing neural tube defects, which are serious birth defects of the brain and spine, such as spina bifida. These defects often occur in the very first few weeks of pregnancy, sometimes before a woman even realizes she's pregnant, which underscores the urgency. First official prenatal appointment is usually scheduled around the 8-week mark, though this can vary. This visit is comprehensive and incredibly important. It will likely involve a series of essential tests, including blood work to check your blood type, Rh factor, iron levels, and screen for certain infections. An ultrasound might be performed to confirm the pregnancy, estimate your due date, and check the baby's heartbeat. A truly magical moment for many expectant parents. It's imperative to avoid self-medication during pregnancy, as many common medications can be harmful to your developing baby. Your first trimester directly fuels your baby's initial rapid development, making nutrition a cornerstone of a healthy pregnancy. It's not necessarily about eating for two in terms of quantity, especially this early on, but rather focusing intently on the quality of your food. Aim for a well-balanced diet rich in a variety of food groups. This includes lean proteins, which are the building blocks for your baby's cells and organs. Think poultry, fish, low-mercury varieties, beans, and lentils. Whole grains, such as oatmeal, quinoa, and whole wheat bread, provide essential fiber, B vitamins, and sustained energy. And of course, a colorful array of fruits and vegetables will supply a spectrum of vitamins, minerals, and antioxidants crucial for both your health and your baby's growth. Don't forget dairy or dairy alternatives, which are important for calcium. Speaking of specific nutrients, increasing your intake of iron and calcium is particularly important during pregnancy. Iron is vital for producing hemoglobin, the protein in red blood cells that carries oxygen to your tissues and, importantly, to your baby. Iron deficiency anemia is common in pregnancy and can lead to fatigue and other complications. Good food sources of iron include lean red meat, poultry, fish, lentils, spinach, and iron-fortified cereals. To enhance iron absorption, pair these foods with vitamin C-rich foods like oranges or bell peppers. Calcium, as many know, is essential for building your baby's bones and teeth. Dairy products like milk, cheese, and yogurt are excellent sources, but if you're dairy-free, you can find calcium in fortified plant milks, leafy greens like kale, and tofu. Alongside these nutrients, staying adequately hydrated is paramount. Aim for at least 8 to 10 glasses of water daily. Certain foods and substances can pose significant risks to your developing baby during this vulnerable first trimester. Raw or undercooked meat, poultry, and eggs can harbor harmful bacteria like Salmonella and Listeria, which can cause serious infections. High-mercury fish, such as shark, swordfish, king mackerel, and tilefish, should be avoided as mercury can impair fetal brain development. Always opt for low-mercury options like salmon, cod, or shrimp, cooked thoroughly. Unpasteurized milk, cheese, and juices can also carry Listeria, so always check labels. It's also wise to limit your caffeine intake. The first trimester often brings with it a profound sense of fatigue, and it's crucial to listen to your body and prioritize rest. This isn't just a feeling of being a bit tired, it's an overwhelming exhaustion for many women, driven by hormonal shifts and the incredible amount of energy your body is expending to support early fetal development. Don't try to push through it as you might have before pregnancy. Allow yourself to take naps when needed, go to bed earlier, and adjust your schedule to accommodate this increased need for sleep. Activities like brisk walking, prenatal yoga, or swimming are generally considered safe and beneficial during the first trimester. There are critical lifestyle adjustments to make to protect your developing baby. It's absolutely essential to avoid smoking and any exposure to secondhand smoke. Recreational drugs must be completely avoided. as they can cause irreversible harm. It's also advisable to steer clear of hot tubs and saunas, as raising your core body temperature significantly, especially in the first trimester, has been linked to an increased risk of neural tube defects. Be cautious with heavy lifting and strenuous physical activities that could put undue strain on your body. Lastly, minimize your exposure to harmful chemicals found in some cleaning products, pesticides, and industrial environments. One of the most concerning signs is severe nausea or vomiting that prevents you from keeping any food or fluids down for an extended period, often more than 12 to 24 hours. This could be hyperemesis gravidarum, a severe form of morning sickness that can lead to dehydration and malnutrition, requiring medical intervention. Heavy vaginal bleeding similar to a menstrual period or the passage of clots is another critical warning sign, as it could indicate a miscarriage or an ectopic pregnancy. Some light spotting can be normal in early pregnancy, but any significant bleeding needs to be evaluated immediately. Severe abdominal pain or persistent, intense cramping, especially if it's localized to one side or accompanied by dizziness or shoulder pain, also requires urgent medical assessment. Painful or burning urination, or a frequent urge to urinate accompanied by pain, could indicate a urinally, persistent dizziness, lightheadedness, or fainting spells should not be ignored, as they could be signs of low blood pressure, dehydration, or other underlying issues. It's a time to be gentle with yourself, to acknowledge the immense work your body is doing, and to celebrate the miracle unfolding within you. Embrace the changes, seek support when you need it, and trust in the process.